Tuberculosis, commonly known as TB, is an infectious ailment primarily affecting the lungs, caused by specific bacteria. Transmission occurs through airborne particles expelled when infected individuals cough, sneeze, or spit. Fortunately, TB is both preventable and treatable. It's estimated that roughly a quarter of the world's population has been exposed to TB bacteria. Of those exposed, approximately 5 to 10% will eventually display symptoms and progress to TB disease. Those who are infected but not yet ill with the disease cannot transmit it. TB disease is usually treated with antibiotics and can be fatal without treatment. In certain countries, the Bacille-Calmette-Guérin (BCG) vaccine is given to babies or small children to prevent TB. The vaccine prevents TB outside of the lungs but not in the lungs. In 2008, two 9,000-year-old skeletons were unearthed by archaeologists. The exact cause of death for these ancient individuals remains uncertain, yet evidence shows their bones were infected with a bacterium that is all too familiar. What exactly is tuberculosis? This disease remains a significant global threat, causing more deaths than malaria or even HIV/AIDS. But what precisely is tuberculosis, and how has it persisted for so long? How does tuberculosis operate? Typically airborne, TB bacteria, known as Mycobacterium tuberculosis, enter our airways and infect our lungs. Macrophages, immune cells, rush to the site of infection, attempting to engulf and break down the invading bacteria. In many instances, this immune response is effective in clearing the bacteria. However, in individuals with underlying medical conditions, ranging from malnutrition and HIV to diabetes and pregnancy, the immune system may not be robust enough to eradicate the intruders. If this is the case, Mycobacterium tuberculosis will replicate within the macrophages, forming colonies in the surrounding lung tissue. As the infection spreads to more cells, the bacteria release enzymes that degrade the infected tissue, resulting in chest pain and bloody coughs. The lung damage leads to decreased oxygen levels, which initiates a cascade of hormonal changes, including reduced appetite and iron production. From here, the microbes can disseminate to other parts of the body, causing back pain and mobility issues in the skeletal system, abdominal pain in the kidneys and intestines, and headaches, even impaired consciousness, when affecting the brain. These symptoms manifest the classic image of TB: weight loss, persistent coughing with blood, and pale skin. This appearance earned TB the moniker white plague individuals with compromised immune systems. The outward symptoms of TB even contributed to the popular notion of vampirism. Despite or perhaps because of these less than scientific beliefs, this era marked significant progress in TB treatment. In 1882, the German physician Robert Koch identified the bacterial cause of the disease. 13 years later, physicist Wilhelm Röntgen discovered X-rays, which enabled physicians to diagnose and monitor TB's progression within the body. These advancements paved the way for reliable and effective vaccines initially for smallpox, and later, in 1921, the BCG vaccine was developed to combat TB. These breakthroughs laid the foundation for modern antibiotics, which are currently the most effective treatments for TB. However, antibiotics do not address a crucial diagnostic challenge. Approximately 90% of TB-infected individuals do not exhibit symptoms. In these latent infections, the TB bacterium may remain dormant, only becoming active when the immune system is compromised. This latent form of TB complicates diagnosis significantly. Treatment of tuberculosis. Even when diagnosed correctly, traditional TB treatments can span up to 9 months, requiring multiple drugs and often causing side effects. This lengthy treatment duration often leads to non-compliance, allowing bacteria to develop resistance to the drugs. Today, TB remains prevalent in 30 countries, many of which are grappling with other health crises that exacerbate TB and trigger latent infections. Furthermore, accessing treatment can be challenging in these regions, and the stigma associated with TB can deter individuals from seeking help. Health experts concur that improved diagnostics, faster-acting antibiotics, and more efficacious vaccines are imperative. Researchers have already developed a urine test yielding results within 12 hours, as well as a novel oral treatment that could reduce treatment time by 75%. With advancements like these, we can hopefully combat TB more effectively. For more health-related updates, refer to the description below. We hope you found this video informative. Don't forget to like and subscribe to stay connected. Thank you.